Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
It's not your fault. You didn't do anything wrong. You didn't ask for this. It's not because you didn't bathe. It's not because you didn't use the right soap. It's not because you used the wrong shampoo. It's not because you ate the wrong food. You have an autoimmune disease.
Hello, and welcome to Getting Clear on Psoriasis. I'm your host, David Brandt, and I've been living with psoriasis for more than 30 years. In this podcast series, we will bring you stories about different people's experiences with psoriasis and hear from medical professionals who treat the condition every day. Our goal is to share information to help you manage your psoriasis, seek out the best treatment options, and live a more full and productive life. This podcast is for general information purposes only and should not be substituted for medical advice. Please consult your own medical professionals with any questions regarding a medical condition, advice, diagnosis, or treatment. So I'll give psoriasis one thing. It's persistent. It first showed up as a documented medical condition around 400 BC. Psoriasis affects around 8 million people in the US, 125 million people worldwide. And yet, a surprising number of folks still view it as some sort of skin rash, something you treat by rubbing a cream onto your skin for a few days. But what most people don't understand, unless of course they have psoriasis, is that it can be a lifelong condition that often causes a lot of misery, both physically and emotionally. Psoriasis is hereditary. It can lie dormant for years and then awaken out of the blue, producing scaly patches or rashes pretty much anywhere on your body.
I was at a Christmas party and my scalp was itchy. I felt a big scaly patch on the back of my scalp.
That's 54-year-old Tammy Soretti. She was diagnosed with psoriasis in 1996 and with psoriatic arthritis in 2008.
Because it was Christmas time, I couldn't get into a doctor. And by the time I could see a doctor between Christmas and New Year's, 75% of my scalp was covered with this. And he diagnosed it as psoriasis, which I had never heard of before. I had no idea what it was. And we kind of went from there.
Currently, there are 3 main ways to treat psoriasis. For milder cases, there are a number of different topical ointments and creams. Another method is called phototherapy. This is usually done in a dermatologist's office using a light box, sort of like a tanning bed, to slow down the excess growth of skin cells. Then there are targeted medications, administered orally or through injection, that go after the root cause of psoriasis, an overactive immune system.
I spent years just doing topicals and everything that he started, and that was in December of 1996. But he didn't tell me that when all of those scales started coming out, that my hair would come out with it because they were all stuck together. And I had short hair, but I went from this short hair to what looked like almost like dreadlocks because it all tangled together.
Tammy's doctor had started her on a peanut oil steroid lotion.
And I couldn't get the peanut oil out. My hair kept coming with it. It was really a devastating experience.
After developing psoriatic arthritis, Tammy started seeing a rheumatologist who put her on steroids and methotrexate.
And that didn't work, so she switched me over to biologics. My first biologic didn't work. My second one, I was on it for a long time thinking that it worked. It didn't work for my psoriasis, but I was thinking that it was helping my joints. But it really wasn't because I ended up with a lot of joint damage. I just didn't realize that it wasn't working as well as I thought it was. I had to have surgery and had to go off it for 2 weeks. And when I started again, it didn't work at all, which is very common.
Tammy says after all that, it was tempting to blame herself for having psoriasis in the first place, but she's come to reject that attitude.
Number one, it's not your fault. You didn't do anything wrong. You didn't ask for this. It's not because you didn't bathe. It's not because you didn't use the right soap. It's not because you used the wrong shampoo. It's not because you ate the wrong food. You have an autoimmune disease. The soaps you use, the lotions, the food you eat can have an impact, but it was always there.
Dr. Ahmad Shatil Amin shares Tammy Soretti's perspective. He's an assistant professor at Northwestern University and has been a practicing dermatologist for 9 years.
One of the first questions that someone asks when they first are diagnosed with psoriasis and it first appears on their skin is they want to know, why the heck did this show up? They've never had psoriasis. They've lived 2 decades of their life without psoriasis, and all of a sudden it shows up. And so their main question is, why do I have psoriasis? Is it something that I did? Is it something in my diet? And so the first thing to explain to patients really is that although we don't understand all the genes that cause psoriasis, it really is a genetic condition. So you're either born with these genes or you inherit these genes from some of your family members. And oftentimes these genes are very silent and dormant, but they can activate and turn on and cause psoriasis at any point in life. It's nothing that you did. A lot of this was probably out of your control, and your psoriasis kind of decided to show up whenever it wanted to show up.
Dr. Amin also tries to explain to his patients that psoriasis is generally a condition that's going to be with them for some time.
Oftentimes, for most patients, psoriasis is a chronic disease. So in other words, I can't give you a magic pill and make it go away and make it stay away forever. If you have psoriasis, for most patients, psoriasis kind of sticks with you for several years, maybe for the rest of your life. And it sometimes does have a waxing and waning nature. In other words, like it may not be as bad as it is today, a month from now or 3 months from now. So it might get a little better with time and it might worsen again with time. So sometimes the condition can ebb and flow.
51-year-old Vicki Wilkerson lives in Shreveport, Louisiana. She was first diagnosed with psoriasis about 18 years ago. In Vicki's experience, some doctors were better than others at communicating with her about her psoriasis.
I wish I'd been more informed. I wish the doctors gave me information or told me where I could find information or be more informed, because I didn't know anything. And what little bit I did learn was of my own research online. So I had no idea. I really had no idea. I did not know how bad the psoriasis could get. I did not know that there was other conditions that could come along with having the psoriasis. I was just in the dark.
Vicki says as her psoriasis worsened, so did her emotional state, and it eventually began to affect her marriage.
After I was on my first biologic, I put so much faith into it that it was going to work, it was going to clear it up. And when it didn't, 6 months later, and I had to stop using that biologic, it really kind of threw me into a tailspin. I got really depressed, even so much so that I'd only been married about a year at that point. I told my husband I would let him out. I would give him a divorce and let him walk away, because I didn't know how bad it was going to get. I didn't know how much it was going to affect my life going forward. And lucky for me, he's a great man, and he stood by me, and he's like, I'm not letting you go.
Many couples aren't as lucky as Vicki and her husband, and relationships sometimes end due to one person's battle with psoriasis and the other's inability to cope with it. So far, we've been talking about psoriasis mainly as a skin disease. But according to Dr. Mona Gohara, Associate Professor of Dermatology at Yale School of Medicine, it's a more complex condition.
It also can be associated with arthritis of the small joints or lower back. And we know now that can be associated with increased risk of coronary artery disease, elevated cholesterol, and even elevated blood sugars, or what we call it, the metabolic syndrome. Gone are the days when somebody comes in the office and we just give them a cream and have them walk out the door when they have psoriasis. It really is now counseling them about not only what to do with their skin, but what they can do and what they should be looking out for in terms of arthritis prevention or treatment, and also being in tune with their cardiovascular risk factors and getting cardiovascular exams.
And many doctors have come to realize the importance of validating their patients' experiences and feelings. Dr. Joel Gelfand is a professor of dermatology and epidemiology at the University of Pennsylvania.
It's really important for the clinician to understand the patient's perspective, how the disease is impacting them personally in terms of the physical symptoms they have. Is it disrupting their sleep? Is the effects of psoriasis causing staining of their clothes, their clothing, or their bed sheets, or things of that nature? Are they itching all night long? As well as the emotional impacts of psoriasis. Does it affect their personal relationships, their intimate relationships? Do they feel anxious or depressed about their disease? Does it affect their ability to work? By having an insight into the degree of physical and emotional symptoms people have related to psoriasis, that gives us a sense of how aggressive we need to be in managing the disease.
And on the patient side, Tammy Soretti has begun to rely more and more on her own inner strength to manage her psoriasis.
You're going to find your new self and be so much stronger for it because you're already stronger than you think. You have it. You got out of bed this morning. You reached out to somebody. You're already stronger than you think. You're already on your way. And hiding it doesn't hide it at all. It just makes you look like a flake instead of your skin looking like a flake.
63-year-old Diane Talbert from Waldorf, Maryland agrees. She's become very proactive about her psoriasis, making yearly trips to Capitol Hill to advocate for people like herself. And she's also spoken before the FDA.
You need to go advocate for yourself and look for a great doctor and do more research because I didn't know. I didn't know we had great doctors out there at all.
Dr. Joel Gelfand encourages all of his patients to stay positive and be their own best advocates.
I feel like people with psoriasis have a unique type of courage. It takes a lot of courage to face our world with a skin disease like psoriasis, and it takes a lot of persistence and effort to get to the right treatment plan that's helpful for the patient. With that in mind, I really encourage my patients to stick to it. That courage, that bravery in the face of frustration and setbacks, pushing forward and getting the answers you need, trying treatments to see which one's going to work for you properly, these are the secrets of success for my patients.
In the next episode of Getting Clear on Psoriasis, we talk about the challenges of navigating daily life with psoriasis.
It took me from a very confident person, because I was very confident in who I was at the time, down to someone who was fearful, ashamed, definitely ashamed, because my skin just looked horrible.
That's coming up on Getting Clear on Psoriasis. If you like what you heard, head over to Apple Podcasts and leave a 5-star rating and write a positive review. It'll help spread the word to more people who might be in need of support. And if you know of someone living with psoriasis, be sure to tell them about this podcast. As always, we welcome your feedback, so send us an email to psoriasis@ghlf.org. Until next time, I'm David Brandt. Thanks so much for listening. This podcast is made possible with support from Walgreens and Alliance RX Walgreens Prime, sponsors of the Global Healthy Living Foundation.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.